Yes, subscribe. You always dey watch we program them, but you not subscribe yet to the channel. All wetin you get for do, press this red subscribe button and then you come over here and press this bell. To the bell option, press this one with all. E don done. E no get for cost you anything. When you do this, na sign for show say you dey support we for make we do more. Thank you for wey you don help me for share this program. Yeah! God bless you.
And we dey come over to we studio guests. We get huge experience in global health. We now Dr. Austin Demby, sorry. Well, Dr. Austin Demby now be Director of Principal for the President's Emergency Plan for AIDS Relief. Musa be head one department. We in portfolio now be $2 billion United States dollars for global HIV and AIDS. Dr. Demby na epidemiologist and virologist. We been work na Salone, na the Lassa Fever project, na the eastern part, and also been lead the US response during the Ebola outbreak na the country. Well, as as Minister of Health, a ministry in vision of ensure functional national health service delivery, high quality healthcare services, and accessible, equitable, and affordable for everybody na Salone. Inside 2018, Dr. Demby received the 2018 Distinguished Alumnus Award from the African American Institute. Now the organization is 65th annual award dinner in New York. But prior to that, also Dr. Demby gets 42-year experience in global health, and also he worked in Salone for 10 years before he go work outside of the country for 30 years before he return come na Salone. Now all in life where he don't work abroad, he work in Tanzania, Zambia, Rwanda, Malawi, Ethiopia, and he been there for support them country there also the health care system. With all this experience where Dr. Demby gets from outside of Salone and inside Salone for support global health system, President Bill appoint him for be the Minister of Health. Now a pleasure for getting you, Dr. Demby, as I don't see earlier.
Thank you, Asma.
First, share with me the experience where you get working outside of Sierra Leone, where you help for, build other country their healthcare system. Let me get that experience there from you.
Well, thank you, Asma. I think you're starting from Sierra Leone. I go Fulbe College, yeah. And I think say the week after I done now Fulbe College, I take a job for work in Shebima. Yeah. I don't want to go Shebima in my life, but it was such an exciting and exhilarating experience. I go work in Nixon Hospital. And after they rise to the rank of the actual country director for the Lassa Fever program, in our CDC program. So beyond that, I didn't get an opportunity for go study in the US. After that, I come back Salone. I work for a little bit. Then I get an opportunity for go study back in the UK. I go study UK. Then I come back, but then when the war break out, I go US. So from there now, I'm going to support all in country there. So for build up their health systems. So my initial focus, I'm going to work for the Centers for Disease Control and Prevention, CDC. So I go in the country, I look for see waiting they happen in the country, waiting the country want to, waiting at the state of health in the country there. So and I work with them for build basic systems for be able to develop their healthcare system, looking at multiple domains from the healthcare delivery itself, from the hospital services, from the public health services, from the health workforce, from the pharmacy, from the lab systems, and see how then we're able to build a health system for be responsive to the community they're within the serve. And throughout the country, I don't see the evolution of a place like Rwanda, where the first encounter in Rwanda having about 2,000 to the level outside India now today. We didn't get health insurance where they permeate nearly 98% of the population. where they don't reduce maternal mortality considerably. They don't reduce infant mortality considerably. And we see similar patterns in multiple countries. So my excitement with President Bio giving this appointment now for able for bring now wealth of experience, now Salon, my country of birth, for see how for able for adapt that experience for to Sierra Leone context, for provide high quality medical care, accessible medical care, not to one person or to two people or to the elite, but to everybody. And Asma, one thing I'm really excited about, we convinced me because I get a good job, an exciting job in the U.S. Really to travel all over the world. But one of the things that really excite me about President Buren pitched to me, the concept of human capacity development. He say, look, for build a country like Sierra Leone, you don't want to do random efforts where they're able for suicide, the development they go. He say, for you create a real nation here, you want to get a nation where everybody, all 7 million people live, they work at their true potential, no matter what side they find themselves. Na radio station, na car wash, na motorcycle, na doctor, na lawyer, but they are in true potential. And which is say for able to accomplish that, you get 4 domains. Let we get a very, very educated Sierra Leonean populace, where everybody learn it and is smart enough for able to innovate, for able to create opportunities for themselves. Second, let we get a good healthcare system, where they're able to assure their health. Third, let we get food security. And fourth, let we get infrastructure. So what do they do now for take the health sector and see if I go build up from that for able to support this dream for sustainability and development.
So doctor, with your experience from the different side where you don't work, the countries and where you don't make mention of you going there for going show, so you help them for build basic health systems, and you being appointed as Minister of Health and Sanitation at Salon. Let we just start from then say we able to identify the problems now the solution then they start. Where you take up office, how you go describe the status of Salon health system since you take up office? What do you meet?
Well, in a very challenging environment because, I think say a lot of effort they go on. For example, we don't get a significant reduction in maternal mortality from 1,300, 1,100 per 100,000 live births. It don't drop to about 717, which is really quite impressive, but I think it is still too high for me. You don't get a reduction in infant mortality. And by the way, in spite of all the difficulty, so we get an Ebola challenge where any other country in the world, if you face with that, it will be so devastating. So we're able for survive that, for organize ourselves, for respond to that, for able for stop the Ebola in this country. And some of that experience, now we applied to COVID-19, where today Salon are one of the best placed countries then for able for block COVID-19 in impact in our country compared to other countries around the world. So you get a situation where you get some fundamental things where they work. You also get something where don't deteriorate over time. So for me now, for work with the health care system, for try for rebuild, and for build confidence in the community who they serve, and make sure say the healthcare really responsive to the people that they serve. So I not see it as big challenges, I see it as great opportunities for Salon for get even better and stronger for deliver healthcare.
Right, if you listen to the program, you listen to Good Morning Salon, and at the program you get the Minister of Health, Dr. Austin Demby. Now, earlier when you talk about the side where you don't work, you give them basic system for help in the healthcare system, from lab to the general hospital services. And we come at the time where, challenges there, like how you yourself don't outline, now the health sector, now the country. So what are your main focus, priority for right now as Minister of Health, as you yourself don't talk, you want to give access to everybody now the country, them to healthcare?
So again, not a really brilliant question. For you able to address the healthcare system of this country, you get for be say everybody get access. And so you know to do it at random, you're not a project based or activity based, So would I get money for some project? You just do the project. So what do you mean they try for do now? For look at the whole system and look at life stages, starting with pregnant women. What kind of support and healthcare support we're able to give a pregnant woman such that that pregnancy then at the community get that, such that that pregnancy they go result in a really happy, joyful memory for the parents them and the family there. So you take the pregnant woman as a good starting point and make sure so they can get all of what they need, the vaccinations, the nutrition, the medical, and if they get health issues, for able to address their issues from the conception all the way through the 9 months of pregnancy, all the way through labor and delivery, make sure they then deliver in a hospital facility or a facility where able to get any kind of support where they need, all the way to post-delivery for make sure you get care for them, till you get a healthy baby. When you get a healthy baby, you need for able for deploy services for that healthy baby there, so that you get immaculates them, so that you get the right nutrition, so that you get the adequate bobby water, so that it grow well, and make sure say they engage with the healthcare system, so that they watch in growth part, such that in a healthy baby. Till you go school. When you go school, we want to make sure say we get school healthcare system. We're able to support them because so as then they study hard, as they learn, as their brains form, they get adequate health care. And not a new thing now, in that thing that will get open and grow so in the 60s. All the way to the teenagers. The teenagers, their healthcare needs are different from the mama or from the baby. All the way to the young adults and the adults and the senile, the older people. So I want to look at the whole healthcare system and design a program such that all the services, they hit their life stages here at every point. And not only just hit the life stages at every point, but you get clear targets. You get clear targets such that we want to reduce maternal mortality from the 717 we then get 99, then get 580 something as the target. We want to let the 580 something be the floor. But for really try to go down much lower than that. I talked to my Rwandan colleagues and where they're able to drop down the maternal mortality from 850 to about 200 in 5 years. And we'll talk to her and say, 200 too high for we. We get for reduce her even more. I want that same kind of attitude in a salon.
So as you outline there, you plans there, so where you get now the health sector, we see different things happening. I mean, basic cleaning of the hospitals, them don't be big challenge. I mean, people feel like say the ministry reactive. Only where they keep post on social media, say mortuary, get I man them where they send some come on, we see Okuma them go they place dirty. Meaning president they come, minister they come, the place go clean. The suspension of always all them challenges them. We can't talk about the doctors them because we then get their own concern. So how you they manage all the issues they are so of late from the suspension of doctor, well the only now meets doctor who is not the hospital, and to the cleaning of the hospital, past the year you say president they come or doctor the minister they come before they clean it. This dirty all over the country now the hospital. So how they manage their challenges there?
Okay, so now two aspects of that, on the community-based prevention services and then the hospital clinical services. So, I mean, you're right, not really fair, correct for be reactive to the entire. So hospitals supposed to be a welcoming place. Nobody they go hospital where happy or things they well with them. People in the go hospital where they get trauma, where they get difficulty, their family member get trauma or difficulty, and then they make them go hospital. Important for the hospital be a welcoming environment. Let it be a place where somebody they come where at the end of the experience, they say, oh God, thank God, we get hospital like this now. So cleanliness now, a fundamental aspect of what you require. So what you mean to look at now? First, we get about 24 different hospitals in the country, public hospitals in the country. We get a three-pronged approach for how to solve the problem. You get governance and management issues in the hospital there, so one way we get for deal with. But there are three other domains that we look at. First, the infrastructure. We get for need, we don't actually secure resources for get a major facelift for all of them 24 hospitals there, so and make it much more welcoming and attractive. And not only physical infrastructure, including electricity and water, But what should they also look at now the health workforce with the inside the hospital there. So we try for increase and improve the health workforce, not only in quantity, but in quality. And by that I mean, they recruit no more for recruit's sake. We get doctors today or nurses today. We really want to look at which is the overall need for the country, and be able for target and say which thing we need for forecasting need for all them subspecialty there, all them basic requirements of nurses, doctors, and midwives in the country, and they will begin train towards the target and not only the training, we make sure that the curriculum is adapted for Sierra Leone context and Sierra Leone needs. And after the training, we look for how to best deploy them people there so that all manner they can sit on Africa, they're able to provide services throughout the country. And lastly, we want to be sure that as you go to the location, so we find way for retaining people there, so in the services in the location. So physical infrastructure on one, the health workforce on another. And in the health workforce as well, not just the training component, we want to change the relationship between the hospital and the client. Forget a situation where you get patient-centered care, where the doctor them and the nurses then they work together as a group for able to support the patient, because now the patient I make hospital day. Follow we get a relationship with them such that when the patient come or when the family come, within the left, then come back and say, down in my hospital. Down in my doctor, down in my nurse, down in what they try to accomplish. And lastly, the third domain we would work for, how you will get a hospital where you don't really get updated and get facelifted, and you get a really good complement of staff in the hospital, then you not get drugs there. So the drug component are a major part of what they look for. They explore possibilities for example, in them 24 hospital, they also forget a pharmacy inside the hospital so people then get access with negotiated prices, with negotiated utility, with good quality drugs available at affordable prices. So we believe, say, if you're able for get that facelift there, if you're able for get the health workforce with it, if you're able for get the pharmacy, and if we actually begin explore the possibility of manufacturing we own basic drugs now, so we're possible. We really, in fact, I talked to some people there now about that prospect. We'll be able for at least look at the clinical side of things and make sure say the hospital then welcoming. I go Tonkolili, I go Mabroka.
Because at that time I ask say from the paperwork we don't explain from waiting on the plan for do if you as a minister apart from Connaught Hospital don't go check like how you say we get about 24 public hospitals if you don't go get first-hand information as to waiting they happen at the different hospitals, because apart from Connaught, so many other hospitals and they will get similar concerns. You don't go get first-hand information.
So I don't think I just work for about 8 weeks now. I still try to settle in. But my priority right now for really go out. In fact, on Friday we go Connaught. I go cover the one whole Connaught. But I'll tell you one good news what I see. I mean, go Bombali, McKinney, and Mabroka for other things. Any side way I go, I try to make sure say I carve out time for go see the hospital. I go Mabroka, I was thoroughly impressed with the hospital day. In fact, for me, one of the greatest signs when you say something they work now, the paramount chief, he go to the hospital, he bring him party there for cancer there in hospital. Now that is now what they try to accomplish. At dinner at the hospital, I need to use the bathroom. They say, oh, we get public bathroom. I go to the public bathroom. Now, one of the cleanest public bathroom there I don't see. So you get models.
Not for private hospital.
Not public hospital, not government hospital. Real well clean. The staff then committed. The patient then really happy. I just say the chief they go show people them in your hospital. And I think that's a really great model where me want to see maybe as they go to other hospitals for see how we go able for uplift and improve hospital. The cleanliness issue, I mean, that's a basic thing, and not so Connaught Hospital no more. Every hospital, they actively review. First, we try for pay all of the areas where they owe the hospital and cleaners, and we want to do that expeditiously, not only for Connaught, but for all the hospital. And we look at perhaps the model also they use for outsource the cleaning, if that is a very good model, or we need to look at porters as a possibility. But are they actively review that now so that we will get much more permanent solution, not over Connaught, but for everywhere.
All right, continue for the between the program. Dr. Austin Demby, Minister of Health. Will they go for this short break?
Yes, subscribe. You always dey watch we program them, but you not subscribe yet to the channel. All wetin you get for do, press this red subscribe button, and then you come over here and press this bell. To the bell option, press this one with all. E don done. E no get for cost you anything. When you do this, na sign for show say you dey support we for make we do more. Thank you for who you don help we for share this program. Yeah! God bless you.
We continue with the program. Good morning, Salon. 1 minute after 8. Now the time for my studio clock. And we continue with the program. And we still get Dr. Austin Demby. Now the program this morning, they talk about different issue them way for boost the health sector now the country. Well, Doc, you be done to talk about the different things that you plan for do, the condition of the hospital, how you plan for improve work in progress. It just take 8 weeks now the ministry, but inside that 8 weeks, there are different things don't really happy we're not good for the country. One of which now the incidents with the female doctor we happen where because of that doctors them really concerned. We say according to you, the Minister of Health, the ministry, they set up an independent investigation panel for look inside this matter. But one member at the Salon Medical Women Association, Dr. Eva Hansel, say by all way the ministry they plan for do this independent investigation, therefore set aside the one that will be involved in this case, the government officials them. Where Dr. Hansel explain more to Musa S. Kamara.
This female doctor been they do not all the people from Ministry of Health now in the film and record. Now what mean they be the cleaners them because how this whole thing been a doctina cannot. The people away they work their way now they work under the contract, they not pay them this almost month. Then government or whatever it is bring somebody else. So some kind of discuss will begin. So this week colleague also Dr. Jackson Cole mean they try for film this thing here so make people then go know what in they happen or cannot because other than I do they know what in they happen. And then when people then can cannot, now we the doctor then they blame like if I say now we they clean, now we they dirty.
Waiting at the position of Wuna as Wuna don't put press release. So waiting I wanna point them where they inside this release.
Well the first point we'll make is that he wrong for assault somebody. This thing could have been dealt with in a better way, you understand? So number one, then try for grab this woman in phone Anna. You know they go make assault, public and physical assault per person. So say the woman end up get bruise elbow. Don't you not stop there? Then try for intimidate the woman by telling and say then go to in Boston at the hospital for pulling name na the pay list for the month. Then number 3, then say the woman not in position. The woman cannot the work. So any side within cannot confines na workplace today. And what they try for do not for try for hamburger anybody now for make people they know. And who don't are the people them? The people of Sierra they go use Connaught Hospital. When are the same way they complain, say look pig they pass yonder, look in dog they pass yonder, look all kinds of how the place dirty so. You know, people the way they tell we say we not agree for Connaught Hospital because they afraid say where the place dirty so whose kind treatment no can give you. If you go all the hospital the way they around this country, all man go tell you.
When it comes to sanitation, when according to the minister, we myself talk with them that, then they can change or then they can rearrange the cleaning order and then they can train porters then for take care of the sanitation. But when it comes to the issue of the alleged assault on one of our members, them, what do they expect at this moment?
We want the people that will make the assault. Now then for can apologize. Not to minister for can apologize. We don't hear the apology where the minister don't make. The minister they make the apology, but they blame the lady doctor. That independent inquiry. We want for make it begin like yesterday. We don't waste time because now 1 week they campaign this case so you understand? Because until then people then they come out with the reports, then you're not gonna go tell person for big way you don't know if you're guilty or not. When you they under inquiry, you forgot sit on a house first. After all, you don't be in our government offices before. Inside the Ministry of Health, you don't be. Make them go sit on a house, make them suspend them. And make people them left for begin waka, they blame this lady.
One point where the minister been raised when I been the interview na that when a colleague been they obstruct the activities of the ministry workman them for clean the hospital, and that's according to them now one way and bug them work na the Connaught hospital we make this thing be happen. When I not think say this na genuine concern.
Nonsense. How you they obstruct with phone? It been put up, it been go attack them physically so na no work. We complain but dirty, not also. We know why the dirty they dey. Because the one they wait for work, they not work because they not pay them. Other people then come. You then at that hospital day as a genuine citizen of the republic. You understand? And as a healthcare worker, because when the arata, the mosquito, the all thing and they come, not to the patient they normally they affect we safe, right? So when you hear you say, people then don't come, it taking phone for go look, say make us see who's kind work then they can do. It not go near them, it not go middle them. Now in phone they take picture. Then say, no, you not for take picture. Then try for jog the phone iron. You been can tell and say, please stop recording. The person will stop recording. If you not stop recording, then you get something. But you know they go physically for attack person. Not physical assault.
So according to them, now that this video and sending on social media now one way not being appropriate, you think say that was the only way out for communicate within the happen?
Social media now anything they go there. It not necessarily means to say now you send and they. You understand? Me self don't take video. I can show you video on my phone now where the first step where the dirty been there. But me wait me do me own. I take her send on to the chairman of the board of administration at the hospital. So whether it's send on social media or not to the point. The point is they not me for physically assault her. And waiting we they try for hide. Would they try for hide make the people of Salon no say the hospital dirty? The people of Salon then they tell we say the hospital dirty. The people of Salon now then they shame we now then they send we video. Say look how waiting I take. You understand? So waiting na the problem.
So earlier when you start for talk, you talk about the situation as it is. Say when a colleague been threatened that a name go be removed from the payroll and in the communicator to in boss. With this, una as doctors, una feel threatened or bullied?
Well, we feel to say if you do unto one, waiting they stop you from doing to the other one.
All right. Well, that's one member, now the Salon Medical Women Association, Dr. Eva Hansels. They talk to Musa S. Kamara. Well, over to you, Dr. Demby. Even though we colleagues, quote you many times, I see they talk to the, Dr. Hansels, but you don't hear it from him, and that's the apology not come up from you, or you not for come up from you, or they also, as you they apologize, you blame the female doctor, and also the suspension of the only salon pathologist will be get. So just from the encounter to Dr. Owi's issue. Yeah. So what's the situation now with regards this?
So I really a nice foyer from Dr. Eva Hansels, and he really articulated a very, very strong position there. And an unfortunate event occurred on the 13th, and I think say nobody will justify any of what's happened there. I think say waiting we as a ministry they try for do and try for see how we go able for ameliorate the situation, and at the end of the day see how we common interest between the doctor them and the supervisory ministry now for able for protect the lives and protect the patient that we care for, and at the same time protect the healthcare workers. That's our primary responsibility. And I think so at this point then they get active negotiations through interlocutors, and the negotiations are at a very critical stage. So me, I know one for comment on the situation now, but I think say we respect the healthcare worker, them, every one of them, the doctors, the nurses, then they put their life in the front line for solve problems, for help the patient. And so, we're all there on the same page on this. Like I said, an unfortunate event occurred, and we try for resolve that and try for move forward.
So in as much as you said in the try for resolve and move forward, but then demand now are very clear, then they ask that the people within the alleged say assault the female doctor for step aside in as much as investigation they go on. As the Minister of Health and Sanitation, this can for happen?
So again, I don't want to comment because I think say you get beaucoup channels of communication that go on. Up to last night, we did get updates of information. I know, at this very delicate stage for go way in one way or the other way not will necessarily help the situation. So I think so I'll just say let me just patiently wait for the next couple of hours and see what's going to happen. But like I say now, an unfortunate event now occur, and we try to make sure say we able for address everybody in needs around this as we define common ground and common solution. So me comment now not go really help the situation in any way. I don't stick my neck out a little too far already, but I would like for we get interlocutors where they talk to all of the parties, and hopefully we get an amicable resolution. We will make everybody happy. Coming to Dr. Owies.
Before we come to Dr. Owies, as the active negotiations they go on, morale of the doctors them very very key.
Yeah.
Negotiations go they go on, but if the morale no boosted, na problem.
Yes, yes,
as we speak with the patients them,
Yeah.
and from the look of things, the doctors they really they together in this matter.
Yeah.
Waiting at the morale of them, waiting at the how they now as they work na the health na the hospital there with the patients them as the negotiations they go on.
Yeah. You can never ever run a healthcare system without the doctor, without the nurses, without the dedicated lab people and radiologists. So I think say the doctor are at the heart of the medical operation. So anything we go make them upset, they help patient care. So we primary responsibility now for try for address the issue. So again, I left everything what I do at the world for come home. For come home and my primary responsibility now the healthcare worker and for able to support them. So I ask no more let the public be patient. We want to let their morale be as high as possible. The prospects for doctor in this country is so high. In fact, a week ago I go to the graduation ceremony where in the salon they graduate about 50 doctors a year. Again, the last press conference I tell is, with 7 million people, we need about 5,000 doctors active service in a salon for able to make a difference. If we train 50 a year, it will take me 100 years to get to that. So in fact, I challenge the Ministry of Higher Education to see if we can move on from 50 doctors to modest 200 doctors a year. So we do work on that, and not only for training doctors, but for look at subspecialties. Maybe at some point I will talk about we ambitious program like Carytown, the link between medical education and specialty training. With an active program around residencies. We want for let Freetown not only be the center of excellence, but actually for spread healthcare and services throughout the country. I born in Kenema. I grew up in Kenema. When I grew up in Kenema in the 60s, we get boku surgeon them in subspecialties in Kenema Hospital. So why they don't go down over the years, I don't know, but we will try to resurrect that so that all the provincial, the district hospital, then get a broad range of services and the doctor them, then key to that.
So in this case...
Dr. Owies issue, just done.
So Dr. Owies now we always favorite. Dr. Owies now the hero in this country, yeah. And he done this survey for over 30 years, yeah. And I think so we I think it's in a doyen emeritus person at this space. But this is now one country of 7 million people. Count on one person as the only pathologist in the country. So we did look at opportunities for expanding. We get at one point we can get all the provincial capital, let me get mortuary, all the district hospitals in get mortuary. We did try to get a situation where you're able to train the next cohort of pathologists them in numbers, in quality, so that you spread them throughout the country. Right now we get 2 Nigerian pathologists that they help in Connaught. And I think so we don't appoint a new young pathologist for step-in. And we want to let Dr. Owies be a consultant, an expert, somebody where they give advice. But, 30 years ago, if you say, I am the only pathologist in the country, that will make sense. But 30 years later, the pride for look, I've been doing this for 30 years. Look at the 15 or 30 or 100 pathologists that I've trained in the country. So again, we're not to blame anybody, but not just the circumstances. Technology don't move. The molecular diagnostics around pathology don't change. And it's really important that we get a new generation for supplement Professor Always in effort, for let it be more of a doyen, more like an advisor, more like a consultant to the next generation of pathologists.
You make mention of 2 Nigerian pathologists, them we sitting at the Connaught Hospital, as we talk. But when Dr. Owi's been there as consultant, government consultant, pathologist over the years, we be done the year you see people and be the way they understudy, waiting Dr. Owi's be done they do in case of anything. Up to this stage, Salon not able to forget any person we go serve as we young pathologists pass we get from Nigeria.
So again, that's a sad testimony, because we want to change the narrative there, and for change that narrative there, not to by accident, a deliberate, proactive action. So we can say if you stay in a position of authority, you forget a transition plan, And what you would try to do now and for actively activate that transition plan, they forget the next cohort of pathologists then. And the Nigerian pathologists, they're not there so for about a year now, but now placeholder, we cannot count on Nigeria for pathologic needs.
So it's not the problem we young people are not able to take up since they don't take under Dr. Wiz to this stage?
Yes. Again, Dr. Wiz not there so for representing
an addendum to
but,
that, not only pathologist side no more, even psychiatric up till now after Dr. Naim, just get Dr. Jallo again.
Yeah.
So let's specialize areas then this so this country lack.
So again, I tell you now at the outset, say the way we try for reform the health workforce in Salon, not a random issue. We don't have to try to say, what do we need in terms of psychologists and psychiatrists? What do we need in terms of pathologists? What do we need in terms of cardiac surgeons? What do we need in terms of pediatrics? You get that in advance, then you train towards it. Not over just say, we get scholarship today for trained pathologists, then you get pathologists, then go out there, or we get scholarship for trained internal medicine. We won't forget a systematic approach. So again, Dr. Wiz, not to just a great person, but I think so we to look for now at governance and management. We go beyond Dr. Owi's, but how to do this at a national level. In fact, what you try to do now, forget instruments, forget staff train, and deploy them. In fact, we get money for that now, for rehabilitate and improve all of the mortuary in the country. It's sad we first engagement with Connaught now from the mortuary side, but I walk in there and just say, look, things are not working here.
All right.
Things are not working, and we know depend on one person and find out, say, things they know they work, then we'll not try for fix them. So one go beyond the individual aspect of it, but look at national interest for say how we're able to provide services throughout the country.
All right, continue for the way to the studio, Dr. Austin. Then we will come back to you. The program Good Morning Salon, they continue.
Yes, subscribe. You always the watch we program them, but you not subscribe yet to the channel. All wait you get for do, press this red subscribe button, and then you come over here and press this bell. To the bell option, press this one with all. And done. And no get for cost you anything. When you do this, na sign for show say you the support we for make we do more. Thank you for your help we for share this program. Yeah, God bless you.
We continue with the program Good Morning Salon, where they come to you from 98.1 FM. Where they come with this program to you, Minasma James.
And Mabel Kaba.
8:35, now the time for most studio clock. We still get Dr. Austin Demby, the Minister of Health. And we talk about the health sector this morning. Doc, you earlier make mention of active negotiations where they go on now the Ministry of Health and the doctors there. But I want to make it clear if the negotiations are just for the strike, where they for end or it can involve the issue between the doctor where alleged say the assaults and the strike.
Yeah. I think, Sina, we try to look at a comprehensive solution to this problem. Again, as I say, we get interlocutors where they talk to all of the parties, we hear all of the sides of the stories, and for find not only a temporary solution, but a lasting solution to the problem. So I think they would look at a comprehensive view of it. And we work through an interlocutor or several interlocutors for make that happen.
So it's not the time frame for the negotiations where they go on?
So again, I don't want for obstruct the process.
But how long
will
gonna give them?
It will take long. It will take long because I go and say, just stand by over the next couple of hours, next couple of days or so. But again, I don't want for preempt them, but I think say if you go hear from the interlocutors fairly soon, in a way it go please all of the parties and it go please with nation as well.
All right. Yeah. Earlier also we been the talk. You mean one of you mean priority for reduce maternal mortality, and in reducing it, you also get for look at the infrastructure. Cottage, I believe, say overcrowded. Basic electricity and water are challenged, not only Cottage but also the other hospital them across the country. So from time to time, you can see pictures posted on social media say then go for go lights no day, and so therefore this baby die. So in your own way for make you address maternal mortality, these are the challenges at the hospital them, which you plan for do with regards electricity, constant electricity and water supply, and then hospital, especially with camper Cottage and they are then.
Yeah. So as I've been saying at the outset that we don't secure some funding resources for rehabilitate all of the 24 hospital public hospital and we will really try to prioritize the activities now Connaught and PCMH. Again, the maternal mortality issue very, very dear to me. How for reduce that, and I think say one of the mistake that would make now for focus on the hospital side, because I think say we want to make sure say first you get adequate healthcare support inside the hospital. So right now we try for target about 3,000 trained midwives, not only for PCMH but for throughout the country. So we try for actively work on that. The physical infrastructure, the actual physical space in Sepset, and the electricity and water, now priority and it all built into this infrastructure investment plan. Again, when it comes for reduce maternal mortality, I get a clear strategy for that. First, you want to know who side the problem there. So we, for example, where they get a maternal mortality rate of 717 per 100,000, you want to know who side, by district, by subsections, by chiefdom, who side this they occur. And you want for direct resources at then location in there. And again, not to for just focus on the labor and delivery side of you really want to go upstream of that from conception over the 9 months period, waiting to make people and they get them problem here. So at delivery, if you get high blood pressure, will not get managed till you arrive at the hospital. You get problem. If you get diabetes, if you get other metabolic problems, then we not get addressed. If you get malaria, we not get addressed. All go lead to catastrophic events around labor and delivery. So we go upstream of that and make sure say, as long as somebody don't get pregnant, we are aware of, we work with them and make sure say all of their medical needs, and they take care of them, we engage with them till you get to labor and delivery and post labor and delivery. And what you want to do again now for like I say, for understand who side the problem there, for go district by district. We won't forget maybe at the end of the year, get we Oscar for health. Oscar for health for look for who's are the best district would are able to reduce the number of maternal deaths and by a significant amount, would are able to get significant reduction of pediatric cases there. And we give them award for acknowledge the best hospital there, the best doctor, the best maternal care. And again, for the one that we know they do well, for see why they're not able to do well, which is the reason we make them able to do well, that we're able to put resources in there for bringing co-op. So at the end of the year, we get gold star for the district that we're able to do extremely well. If you get bronze, Will they work with you for move from bronze to silver?
And all of this,
Mr.
Mr. Minister, a lot then are you table currently at the moment, going back from the primary health care taken up a lot they for do, and you don't make mention of plenty in the way you want to do, but you not seem forget all the time where you go need for do this. All things being equal, now approximately sometime about 2 years enough you get for do them work here. But waiting really among all and in the you think so you go able to achieve as Minister of Health and Sanitation, waiting at the short term goal them we want to achieve in all of them challenges.
Yeah. So again, me not an individual, but I work with a team. One of the things that I want to do first now for build this team up a little bit stronger. You know, for example, we want to get health economists on the team, so I want to recruit a health economist. For example, we want to get a business expert in the team. I want to get a business expert. If you want to build pharmacies throughout the country, how you be able to do that. I want to also build a team we're able to follow through. Because we get boku project that way they go on, where if you left on by yourself no more, you can 1 month, 2 months later, you don't see any action. I cannot live with that. I want to know week by week what's in the table for meet the targets. We'll move people and bring new people on board. Perhaps we need to look at the governance as well, perhaps for make them places so semi-independent, semi-autonomous, and then able for raise their own resources and able for implement, and we hold them accountable for outcomes and outputs we get. So again, now just look at the 24 hospital there. So at the same time, just look out as well. Will they create a center of excellence in Kerry Town? Will they bring, in fact, I just in negotiations with IAEA, the International Atomic Energy Agency, for look at this diagnostic capability and cancer treatment program. So over in Kerry Town, we not only get this new modern hospital within the building, at the same time we work with the Chinese for build a tropical disease center. Now the facility there, we try to get a 7,000 square meter warehouse where we will manage all of the logistics and supply chain for we products them. We also want to see if we can link this to the training opportunities where you get this the doctors and the nurses. We will forget specialty training in that facility. So we want to create a whole campus around Kerry Town. At the same time, we just get about $25 million approval for build a pediatric hospital in Lumley. So we really want to move that forward. Again, with Islamic Bank, we don't negotiate about a $20 million program. We want to build a major district hospital in Kerry district. We now get district hospital right there. You know. At the same time, we want to upgrade in a major way the hospital in Pujang and Moyamba. So watch out for the anything that really happen now low-hanging fruit, and you go begin show signs of change. And with the cleanliness, the contracting for cleanliness, you really begin see very, very sharp differences fairly soon.
The issue about CHOs, I don't know if you are aware, say they want a law we for establish for separate regulatory framework for them practice. What thing are you take? Yeah. The CHOs then?
Yeah. So the CHOs are another lifeblood for the health sector. You get the doctor then where they provide specialty care. You get the CHO there where they work in the hospital setting in a lot of cases, but also they're so fundamental to the primary healthcare services on the prevention side of things. So we'll work with them and just see which in that the possibility, which in they're able to do. We're able to help them professionally. We're able to improve on the quality of their work and in their security as well, and the possibility of upward mobility. So I think we're there in the middle of their negotiation. And so again, we want to look at the health workforce holistically. The doctor them, the CHO them, the lab technician them, the pharmacist them, all as a comprehensive group. Each one getting your own needs, each one getting your own concerns, and I think we'll try to work with them systematically, so we'll not just deal with one issue at a time.
Okay, we'll go for this short break. We'll come, then I will continue the program.
Right.
The program now Good Morning Salon, and they come to you from 98.1. Then we go for this short break.
Yes, subscribe. You always dey watch we program them, but you not subscribe yet to the channel. All waiting you get for do, press this red subscribe button, And then you come over here and press this bell. So the bell option, press this one with all. And done. And no get for cost you anything. When you do this, na sign for show say you dey support we for make we do more. Thank you for we don help we for share this program. Yeah, God bless you.
We still get Dr. Austin Demby in the program. Doc, let me look at other area them we very critical and important in the health sector. That's get for do with the ambulance and the waiting support for the inside the ambulance. We don't see from time to time pictures of the situation in the and also blood bank and another critical challenging thing in our hospital. Until the person is sick, now you're gonna see blood important way the person need for get blood. But challenges then they with people donating blood or even the blood bank and the hospital under your administration. Which you plan for doing this regard? Blood, ambulance, and for make sure say the ambulances then get waiting then forget inside.
So blood transfusion service na major component of healthcare delivery all over the world, especially in Africa. I mean, you get pregnancy-related requirement for blood. You get pediatric requirement for blood. I mean, accident and injury requirement for blood. And I think that not so something we take very, very lightly. And so right now, the model within the use now replacement donors, family replacement donors, and clearly that not the approach for a national blood transfusion service. Again, historically, things don't count on no more. Things don't fall down over the years. But historically, we get in a salon a non-remunerable blood transfusion service. And Red Cross now being a really major partner in that. I helped Tanzania build a magnificent blood transfusion service in the country. What you will need for do, again, I go Kerry Town the other day, I see a brand new facility we don't set up, the only thing we're missing now electricity supply, but I think I work with the Minister of Energy. I talked to them yesterday for see how we go activate that. Blood transfusion service require the population for really understand the value of blood and blood transfusion. And usually what you need for do now for work with school children. Because in a lot of cases when you work with adults, the other infection really inside the adults is usually much, much higher. In the case with blood transfusion service, you collect the blood. You collect the blood, then you go test them. And if the blood positive, for example, with HIV, you discard them. But the whole blood bag, they cost about $20 a pop. The whole unit will cost about $30, $40.
But it didn't have a priority for make sure say we
it
get
didn't
some
have a
blood.
priority, but the approach for this nine we need for think of now really need for work on as a priority. So not the replacement donor, not a solution. What you need for do not forget a national system where you work with school children, especially like high school children or the military or people like that, where you're able for donate blood on a regular basis, and not for only donate the blood, but also for able for better use the donated blood by fractionation, because at times you need the red cells, at times you need the plasma only for able for fractionate, so you could use one unit for multiple purposes, And what you need for do now for get a system such that you're able for collect and distribute the blood like throughout the country.
Because that's again another
regional
concern.
hubs,
I don't know if you are aware, say even the small way they now some of the hospitals them now based on connections and you able for provide higher plenty money, they able for get the small way they aware of that.
Done all right. And I can't say, the way you need for do now for go back to the schools and for let the young people understand it a part of national service. Even though you don't need blood today, but by donating blood, one day where you need that, somebody else could donate for you. Now that's not the principle we use for that, So and they pay, you're not supposed to pay for blood. And I think say if you begin pay for blood, you do really destroy the principle behind that, So meanwhile for launch a national program where they look at non-renewable blood transfusion service, and young people are the key for that. In other countries there, you get a badge of honor. Say you don't donate three units of blood a year, and donating 3 units of blood, it doesn't really make much difference to your health. But you were able for, say, with 3 units of blood, you're able for save 10 people their lives or 20 people their lives.
How about, how about the ambulance?
The ambulance, I think, say we don't come a long way from who not can get any ambulances to getting a large number, a fleet of ambulances during Ebola. And the BC, they don't really utilize their ambulances then very, very effectively. The last numbers where I see the number of lives with the ambulance and they don't save for move people in from peripheral sites to sites where they need tertiary care, where they need better care. It's just phenomenal. But their ambulance also, it requires maintenance, it requires support. So we need to revisit that and see waiting at the status of the ambulance and what kind of support they need. Because I think right now, the ambulance, they don't show them real value and true value to Salone. The only thing we will need for do now for maintain that and improve that and create a better system for their use. But now one of the legacies from Ebola we for all to be proud of, that it don't actually change referral systems and networks. Now for just be able to build on and support this. I get this fine ambulance, get bed inside. I get this fine ambulance, get fuel inside. So now the management side of things now we really want to address as we look at this important service at the country.
All right, so I'll take you back to the issue of the foot soldiers. They're now waiting at the different health facilities, the public hospital especially, where now then they before for do the work. After the incident will happen at Connaught Hospital, we see the Ministry of Finance don't disburse money for amend some of the challenge and maybe they don't get them, we get for do with salaries and stuff, send them for the hospital. So at this stage, why the Ministry of Health be need for wait stay challenge come to that point they before now able for get the Ministry of Finance round for let the disbursement happen?
Yeah. So
why the delay
again, now some management issue then they will need for address. Again, we just can't 6 weeks, so but we try for fixed things. Some management things and they will go. For example, with the payment for the healthcare workers, about 6 months of that are being held up in audits. We hire new people there, just to pay people them. The audit principles for make sure say you get the right people that you pay, you get the right documentation for. So he held up the process for a little bit, but clearly 15 months too long. But I think say we did try for how you go streamline the system now, because Ministry of Finance themselves, they don't see what's happening in our corner, they don't see what's happening at the other hospital. They don't want to see themselves be a bottleneck to this. The ministry itself not derive any pleasure at all for let we get people in the strike. So I think say for me, why don't they really try for make this a priority? We go out, we not wait for be reactive to problems, we get for be proactive, for see what's a problem they can anticipate them and try for correct them. And you cannot, as I said before, you cannot run a healthcare system without the health workforce.
Apart from accessibility to the hospitals, then one challenge we again in terms of availability of the drugs. We take the free health care, for example, it don't pass 10 years where Salondom gets that particular program there. You don't go to some hospitals, yes, the environment's clean, for example, the Caremark government hospital, but for let the drugs them available, now other problem than the waiting the ministry they do for ensure say drugs them especially for primary health care and the one the way they under the free health care program able to get drugs where they go to the hospital then.
Again, I think I'm not trying to address this, but I'll try to revisit that. We'll get a 3-pronged approach. First, now then big tertiary hospital there. So we get, the drug needs are extremely high. If you go there, they're not diagnosed for you. You get to go outside and go begin fend drug. At times you don't know the quality and the standards of the drug. So what we will try to do now for see if we could create a public-private partnership with reputable pharmacies. We will actually be situated inside the hospital, and we want to make sure say if we can get tax incentives, we could get standardized maybe cost reduction with supplements. We'll be able to make this available and affordable inside the hospital. With the primary healthcare side of it, you get the free drugs, the free healthcare drugs available. What you want to see if the possibility there for recapitalize the cost recovery model, where you're able to make then drugs just so available at very, very low prices, where were affordable for the people there, and then you recycle the funds where you get out of that. The third approach where we look at from the pharmacy side, now for see if we can get local production of some of them basic drugs here. Which is not the point for go import paracetamol, or for import aspirin, or for import basic thing that they use on a regular basis. So they explore public partnerships, private partnerships for able to look at local manufacture. And right now we get a lot of interested parties. We're very interested, and we don't start negotiations with them. But again, we want to get a situation where you don't need for go buy your antibiotic, not treat.
All right. As we wrap up this program, you don't work in a country then where you go start the healthcare from nothing and you build to something. Tanzania, Rwanda, Malawi, at least go say go thank you the healthcare system with the kind of work where you do with them for startup until then get sweating and get sorted. Come out from their country and they coming back home. Which one gets more challenge for building infrastructure?
Yeah. So me, I know they see that as real challenge. They see it as opportunity. You get an opportunity for make a real difference here. I mean, again, not to me one can go Tanzania and Rwanda for fix the healthcare system. Then get the indigenous kind of approach to it. So we just add to our advice and put money behind them. But what you see in Salon has 7 million people. Salon gets 16 districts. Salon get 140 something chiefdoms. Immanageable. So I see this as a really great opportunity. We only get about 26 public hospitals to deal with. We get a health workforce where we're not phenomenal in terms of numbers we for manage. So I see this like every day I wake in the morning. I see this, could we move the dial on this? Could we make a change here? And what I want to do, not for me as an individual, but could we have a culture as a nation for co-own with healthcare? So, for example, Connaught Hospital, we they fix Connaught, but I want that we get a situation where, Edwards, the alumni, Prince of Wales, the alumni, the Radio Democracy, the Star, then we all co-own Connaught because now we're hospital.
All right. So as leadership at the head of the Ministry of Health and Sanitation, with all the background we get, the work we don't do in other country, you promise for fix the healthcare stay at least to some stage where we don't need for go Ghana for go do ordinary operation.
Now that you work on day in, day out, I mean, again, what's happening? They talk to people and they say, oh, not bring America business canal, not America this, But they tell us, look, the other African country, then either we all begin at the same time, or we be not advanced even before them. The world not static. They're not the sit down wait for it. Then country here, they not move before. We need for regain the upper hand. We need for regain that leadership role. And again, like I say, it based fundamentally on that human capital development and confidence in we as a people. So, we train now, so you say, hey, I go work in Ghana or I go work in America. We want for work now because if we not do it, who can do it for you? I mean, I left everything will come home because I feel say impossible now. So why they talk to the young doctor? Like I say, I go commerce. We graduate 50 doctor there. If you see where they shine. They want to get on with the business of helping people. And I think what we want, let them see a champion in the ministry for create an environment for let them thrive.
All right, many thanks for joining the program this morning. So many things and for talk about. We hope we're going to get you from time to time for the give updates on waiting to happen at the ministry.
Thank you very much, people. And I don't know, maybe we'll start Ebola. I said they call me Master Sabi Manpower, body business.
Way back.
Way back,
Aye.
But I just a joy for come back home. A joy for hope that this is not to health for health's sake. This is not health for nation building. And I really want to create a partnership between the public and the medical service.
Yeah.
We want to do this together for make Sierra Leone a better place.
All right, many thanks to you, the Minister of Health and Sanitation, Dr. Austin Demby, for you can give updates on waiting you plan for under your leadership in the Ministry of Health and Sanitation. Now, this edition of the program, Good Morning Salungo. Lefona plenty thank you to the production team. Michael Sambola and Alex Lawrence Kumar produced the program. DJ Ahmad gave technical support. Moses Kavra make on see you live on Facebook. So till we meet again, Mabel Kabade say goodbye.
Stay tuned at 12 for midday show and at 1 for Shekede. And throughout the day for more programs and 7 for national news. When we ask my James Steve, wish you all the best.
Yes, subscribe. You always the watch we program them, but you not subscribe yet to the channel. All waiting you get for do, press this red subscribe button, and then you come over here and press this bell. To the bell option, press this one with all. And done. And no get for cost you anything. When you do this, na sign for show say you the support we for make we do more. Thank you for your help we for share this program. Yeah, God bless you.